Good afternoon and welcome to another episode of Speaking from the Heart with Dr. Emrani. Today we will discuss briefly sleep apnea, as some of you have written to me and asked me why it's important. First of all, let's define sleep apnea. It is a potentially serious sleep disorder in which the breathing stops and starts suddenly, and there is a choking that occurs at night where the oxygen actually drops. Let's talk about what are the complications of this. The complications are that it can lead to high blood pressure that cannot be managed, or even heart problem. Atrial fibrillation, which is an irregular heartbeat, can be caused by sleep apnea. Congestive heart failure over long term can be caused by sleep apnea. Some people have daytime fatigue, or actually fall asleep behind the wheel, or fall asleep at work or at school like I used to. Complications with medications and surgery are higher in people who have sleep apnea. Liver problems such as elevated liver enzymes, and the final complication is when your partner doesn't sleep because you snore. The symptoms are severe fatigue and loud snoring, episodes of breathing and stopping to breathe. There is this format that happens for those of you who sleep next to somebody with sleep apnea, where somebody snores and then they stop their breathing and they choke themselves into waking up. There is morning headache and difficulty sleeping at night, and attention problems. Usually causes of sleep apnea are multiple. Being overweight is very important. Having a large neck size can contribute to this, or a narrow airway can contribute to this, and a large palate, which can actually obstruct, can lead to this. The tests are the most important test is going into a sleep lab center and sleeping overnight, where you are hooked up to a machine and observed for a drop in oxygen during the periods of apnea, and you get both diagnosed with this and you get treated. Treatments are multiple, the most famous one of which is a mask that goes either over the nose or over the mouth and blows positive pressure. That is the strongest type of treatment. There are also medications, and there are surgeries where the palate can be adjusted. There are also dental implants. However, the most important treatment for these are the devices where they go over the nose. And I've had many patients where either their blood pressure or their heart failure or their breathing or their falling asleep have resolved after this kind of treatment. Please, if your partner snores or if you are not getting a good night's sleep, get tested for this. It is a very important condition. Thank you for asking me the questions. Take care.